Fantastic to have you with us on Eye on Health here on Dubai Eye 103.8. I'm Helen Farmer, and we are introducing you to some of Dubai's most in-demand doctors and touching on some topics that perhaps you might not be affected by, but I'm pretty sure someone you know will. Diabetes. This week was, of course, World Diabetes Day earlier this week, and many refer to it as the silent killer. It can just sneak up on you. Here in the UAE, it's estimated that as many 1 in 5 people have the condition, with that number expected to double by 2040. So what can we do about it, whether it's prevention, treatment and management? Joining us now is Dr. Aswin Pankajakshan, a specialist endocrinologist at NMC Royal Hospital. Aswin, thank you so much for being with us. Really do appreciate your time at what I'm sure is a very busy time of year. I'd love, before we get into the do's and don'ts, the technicalities, the medications, to really get a bit of an understanding for those of us who haven't got decades of experience in the medical field of what diabetes actually is, what happens or doesn't happen in the body.
Yeah. First of all, thank you for inviting me, for giving this opportunity to speak about diabetes. So what happened? Diabetes is one of the most common conditions we see. Me being an endocrinologist, we are dealing with hormonal disorders. One of the most common thing we deal with is diabetes. So what happens is that there is a defect in the way body handles glucose. So glucose is what is needed for the body function. It's needed for energy. So what happens is that there is a defect in the way body handles the glucose. And what happens is that, as a matter of fact, the blood sugar level, if we measure it, it is going higher. That's what happened in diabetes.
So it's a body's inability to regulate and respond?
Yes.
Okay.
Inability to utilize glucose properly. And as a result, the glucose starts going up.
So, Doctor, tell us a little bit then about insulin. What exactly is it and what's it doing in our bodies?
Okay. So what happens is the main thing that controls the sugar level is insulin. Insulin is a hormone which is produced by the pancreas. So what it does is that it make the body to utilize the glucose. So from going from the blood to inside the cell, for the cell to use glucose, insulin is needed. So diabetes is a condition where either the insulin production is less or the insulin effect is less.
Okay.
Insulin effect being less is called insulin resistance. Insulin production being less is insulinopenia. When you have the diabetes types, we have mostly the type 2 and the type 1 diabetes. So type 2 diabetes is when there is both these problems. The insulin production is less, at the same time, insulin effect is also less. And one of the things that reduce the insulin effect is obesity. As people gain their weight, the insulin become less and less effective, and the chance for diabetes keeps on increasing. So that's the thing that is there in type 2 diabetes. So both are affected. But if you go to type 1 diabetes, it is a different sort of etiology. So what happens is that the pancreas stops producing insulin altogether. So there is literally zero insulin. And so this type of diabetes, the type 1 diabetes, occur in the children mostly, but we do have adults having type 1 diabetes. But the thing is, there is zero insulin production. So these patients have to be on insulin from day one, and they can't even miss even 1 or 2 doses of insulin. They can't miss in a day. They mostly are on 4 times insulin a day, which makes it difficult for them to take, but they need insulin all the time and can't miss it. So that's the thing.
So really closely monitored and managed. I would say technology is on our side. You know,
Yes.
it's a lot easier now than it was
Yes.
20, 30 years ago. I would like to go back to type 2 diabetes. As we said, this is unfortunately very prevalent in the region. And
Yeah.
we can point to obesity. We know as the UAE, it's an overweight nation. We can point to that sedentary lifestyle, the buckets of chicken, the late night iced coffees and all the rest of it.
Yeah.
But what do we know about the genetic component as well, or either lifestyle factors outside of diet and exercise?
Yeah, so genetic factors are an important thing in type 2 diabetes. Like if the parents have diabetes, you have to be double careful. Like if father or mother has diabetes, then their risk of diabetes is around 40%. If both parents are having diabetes, the risk is going to around 60 to 70%. So you have to be really careful if both parents have diabetes. And you have to take the preventive steps really early. So genetics is an important factor, but what we see more and more in our practice in Dubai, I've been in Dubai for 5 years, so what I see is that nobody without any family history, no one in the family having diabetes, but they are getting diabetes pretty young, in 20s, 30s, and lifestyle and diet, lack of exercise, poor sleep, spending a lot of time in the car, not having time to exercise, being exhausted when they come back home, that they can't even think of exercise, just go back to bed. So
I'm
all
laughing
those
because that
things-
sounds like me.
Yeah.
But we are also a very hard-working
Uh-huh.
part of the world. What about that stress factor?
Yes. Other thing is also the stress. Stress also does have an effect on the insulin resistance. So I was telling about how the insulin effect reduces. It's called insulin resistant. So what happens is that when you are stressed, your body produces more cortisol. That's a stress hormone. The cortisol also reduces the effect of insulin. So it worsens the insulin resistance. So when you are someone is chronically stressed, that can be an additional factor that actually leads to type 2 diabetes also. Apart from being inactive, being obese, stress also makes the things worse actually.
Let's talk signs and symptoms. What are some of the ways it can manifest physically and mentally that might bring someone to your clinic?
Yeah, so the thing to understand is that diabetes is a silent disease more often than not. So many of the people actually might not know that they have diabetes. So the first thing to understand is that there are not symptoms all the time. Only in a subset of the patients there are going to be symptoms. So it's very important to start screening for diabetes if you have family history of diabetes, if someone in the family has diabetes, or anybody here above 30 of age actually should have a sugar checkup. And if it's coming normal, they may reduce it to once in 3 years or something like that. If it is coming borderline, they have to check it regularly. So that's the thing to understand, that it's not always with symptoms. But when the symptoms come, the usual thing is that patients have weight loss, they feel tired all the time, they can have a lot of urination. So they wake up many times in the night to pass urine, and they drink a lot of water because they are thirsty all the time. So being thirsty, passing a lot of urine, waking up in the night to pass, that we see such patients quite a lot. And also once in a while during the diabetes day, people have screening and then they come to know as a surprise that they have diabetes. That's also very common. Yeah. So the thing is, if family history is there, you have to keep checking. I mean, by the moment you are 30 or even earlier here, because we don't have any age cutoffs here, so you have to start screening for it.
And just to demystify that screening a little bit, is it as simple as a blood test?
Yeah, it's a simple thing. Easiest way is to even check a glucometer thing, which actually takes literally 1 or 2 seconds. So which can be done in the clinic. I mean, that's not the most accurate, but it's fair enough. I mean, if you're doing a fasting, like you're fasting, and you can check a blood test. But there is another blood test called 3-month average, HbA1c, that shows your sugar over the last 3 months. So that test can be done, and it's a good way to screen for diabetes, as well as your fasting and 2-hour after food levels that is there.
Doctor, I've read that men are affected perhaps more often than women. Why is that, and how can it affect men in particular?
So what is seen is that the men seems to have diabetes about twice as common as females.
Wow, that's significant.
In most part of the world, it is like that. So there are a lot of research on that, and one of the reasons is that the men tend to have more visceral fat. Visceral fat is fat in the liver.
So around the internal organs.
Yes, around the internal organs, the fat is more in the. If you take the male, that is more common. But if you take females, it is a peripheral fat. It might be in the thigh, might be on the abdomen, but in the liver, fat is not as high as in men. Okay. And it is a liver fat which is responsible for this insulin resistance, which produce a lot of hormones which cause insulin resistance. So because of that fat distribution being a major factor, that is one of the reasons why men have more diabetes. So if you take two, a men with obesity and a female with obesity, what is that? The men is usually more unhealthy as compared to the female with the same level of obesity actually, because the weight tends to be more on the peripheral distribution.
So men have that fat in more of a dangerous place when it comes to diabetes. Yes. In some ways, when people come to your clinic with these symptoms, it's a bit of a happy ending because they get a treatment plan, and hopefully they are mindful and responsible enough to follow that. Yeah. If someone leaves their diabetes unchecked, or they're unaware of the condition they might be living with, what can that lead to, doctor?
So once someone has diabetes, so two things. Once someone finds out that they have diabetes, it's very important that they accept that they have diabetes. So what happened mostly is people might come for follow-up, like for the first 2 months, things are good, and then they just stopped everything, they stop follow-up, and then they don't do anything about it till the next symptom comes. That's the most common thing seen with the younger population. So that is an absolute no. And the mainstay of treatment in diabetes is lifestyle and exercise. You can give all the medicines, But if you're eating everything and if no control on that, nothing is going to control the sugar. You're going to keep on increasing the medication. That's not going to work. So mainstay in the treatment, the first most important step is lifestyle, which is going to have exercise and eating healthy, carbohydrates being kept under control, looking at the fat intake. And the main thing is reducing refined sugars would be really good, like sweet drinks, sodas, all these things have to be kept under check. Also, the rice, bread, pizza, pasta, all those refined carbohydrates, that has to be kept on the lower side. That's very important. And then exercise. Moving is the most important thing. I would like to give some details about that further on regarding the exercise. So, on an average, it's been found that anybody who walks at least 7,000 steps per day lives much longer than someone who does less than that. But when it comes to diabetes, what we recommend is around 10,000 steps per day or 150 minutes per week of physical activity, something like brisk walking. And if it is jogging or running, you need maybe 75 to 150 minutes. So that's what is needed per week. It's not a big ask, but still people find it difficult to do that.
I think there's a bit of a misconception about exercise that it has to be, you've got to be doing CrossFit 5 times a week. It's about raising that activity level in a way that feels accessible and not intimidating, because that's how you build on that fitness.
Yes. So anything would be, for example, anything like pushing a heavy furniture even would be actually moderate level exercise. It will be similar to is a brisk walking. And so our daily activity, just even if you move around, make sure that for us, we try to walk in between seeing patients. We try to, not always possible. So just take a walk around when you are sitting at this thing. Those small things all matter and add up to the steps. Focus on reaching at least 7,000 steps per day. If you can do 10,000, it's great.
I'd like to go to the darker end of diabetes, if you don't mind. If things do go untreated, we're talking about dangers to heart health. Eyesight, we know, is a big factor with diabetes. Even things like, amputations, sexual function. There's all sorts of side effects that we think are perhaps far too serious for something as common as diabetes. Tell us a little bit more about those, please.
So what happens mostly, as I already told, is like people have diabetes in the initial years, they don't take care of it. But the fact is that even from the beginning, the sugar does have an effect on the heart, on the eye, all the organs. Literally all the organs can be affected by diabetes. Most commonly affected is the heart. And the most common cause of death in diabetic patient is due to heart disease. And around 60 to 70% of the diabetic people get some sort of heart disease when they're 60s and 70s. So it's very important to control the diabetes. So when someone gets diabetes in their 20s or 30s, sometimes they ignore it for the first 10 years. But the thing is that all those years, it is affecting the heart, it's affecting the eye. When it comes to heart, this is the main thing. And if such a person has on top of diabetes, hypertension, cholesterol, and obesity, it increases the risk even more. And the other thing which worsens the risk is smoking. Smoking is like a deadly combination with diabetes. So it literally kind of accelerates everything more faster. For example, a diabetic patient is twice as likely to get heart disease. But if you add smoking on top of that, it's like around 4 times risk of having heart disease as compared to a normal person. So smoking can completely worsen the whole thing. Then having eye screening is very important because essentially diabetes affecting the eye, it doesn't lead to any vision problems, but the changes happen in the retina, which can be picked up only in screening. Another thing actually, which I would, then it can affect the nerves, which cause pain in the feet. People get tingling in the feet and it affects their quality of life because in the sleep, it becomes a problem. All that is there. And then very importantly for men is the sexual health also. Most of the diabetic patients are not aware that the diabetes can affect their sexual function, including the erection is affected to a greater way in diabetes. So what diabetes does is it can affect the small blood vessels and the nerves, and these are needed for proper erection. So what happens is that if the diabetes is uncontrolled, blood pressure, cholesterol, all these are uncontrolled, they can have a big impact on the erectile function. And in most of the cases, the patients are unaware of such a correlation that diabetes can affect this. And when they come, already there is a lot of damage, but still, if you make sure your sugars are controlled, cholesterol, blood pressure is controlled, still you have a chance of getting that erections and all back healthier. Maybe not to the same level, sometimes you need medications, but the most important thing in the reversal of if such a thing happens is having proper exercise. Nothing has been proven to work as well as exercise, like having 45 minutes of brisk walk per day and weight loss are the things which have been found to have a great effect on this reversal of the erectile function.
Doctor, what about reversing diabetes? Is it possible, or is this something, once you get that diagnosis, it's disease management for life?
Yes. So what we have, there was a big study in the UK, and after that they found that we already knew that it's possible to reverse diabetes. So the thing is, it's possible to reverse diabetes with weight loss. Weight loss means you are actually having a healthy diet. Having healthier diet, exercise eventually can lead to weight loss. So if someone loses around 5% of their body weight, their diabetes can improve quite a lot. And if they lose around 10% of their body weight, for example, a 90 kilo person, if they lose 9 kilos, 100 kg person lose 10 kilos, what happens is that the insulin resistance goes away. So why I was telling in the beginning part about the insulin resistance with obesity. So what happens is that the liver fat comes down, the body fat comes down, insulin resistance comes down, your insulin is more effective, and your sugars might be controlled without any medication. So it is possible to reverse diabetes with a healthy lifestyle, losing weight. So that is possible.
And keeping the weight off.
And keeping the weight there. But the thing to understand is that it's not this thing. So if you have to stay on the same track, if it needs to stay reversed, it is not like cure. You are reversing it. It's there. Diabetes is there. So if you continue your healthy lifestyle, it can be kept away. Diabetes can reverse back, and you can keep away diabetes for years to come also. It's possible.
Dr. Aswin, thank you so much for your time. It sounds strange to say Happy World Diabetes Day, but I know it's a very big focus for you there at NMC. And of course, all the very best to you and your patients. Thank you so much.
Thank you so much. Thank you, Helen, for having me on the show. It's a pleasure to be here.
Dubai Eye 103.8.
Join the conversation.